I am Dr. Narsaraju. I work as a senior interventional cardiologist and clinical director of Sunshine Heart Institute. So today I am going to talk to you about heart. Heart is of the size of the fist of the individual. It's located in the center of the chest and it keeps pumping blood like an engine of a motor. It keeps pumping blood throughout the various body organs, and it basically does the function of supplying blood to the organs which are working, and also at the same time it pumps blood through the lungs where it gets oxygenated, and the oxygen that is obtained from the lungs is delivered to the metabolizing tissues, which are the tissues where the maximum work is happening. So heart is like an engine, and it has got two circulations. It's one circulating through the lungs, that's called the pulmonary circulation, and it is also pumping blood through the body called the systemic circulation. So both of them work in series. The pulmonary circulation as well as the systemic circulation work in series, and blood goes through the lungs, and through the lungs it comes into the heart, again goes into the body, and from the body the blood that is deoxygenated, which is deprived of the metabolic nutrients and oxygen, that will come back again into the heart. Again it will get oxygenated by going through the lungs. Heart has four main chambers, the two upper chambers and two lower chambers. The upper chambers are called atria and the lower chambers are called ventricles. The atria, the upper chambers, are the ones where the reception of blood from the lungs or from the body happens, and the ventricles, the right and the left ventricle, are the ones which pump blood through the pulmonary circulation and systemic circulation respectively. So the blood flow to be unidirectional throughout the heart as well as throughout the circulation is a mandatory phenomenon, and the flow of blood through the heart and the vessels which come out of the heart is maintained by in a unidirectional fashion by the presence of valves, and the pumping of the blood is mainly met by the ventricles, the left ventricle and the right ventricle. So the diseases which affect the heart can affect the valves or the pumping chambers, that is the ventricles, or the blood vessels which are supplying blood to heart muscle itself, called coronary arteries, which are nourishing the heart muscle and allowing it to function as an effective pump.
Hi kids, I am Dr. Naveen Narotra. I am a neurosurgeon working at the Sunshine Hospital. So as a neurosurgeon means that I operate upon the brain, that is the most what we call the difficult or curious organ in the body. What we do is all because of the brain, and with the brain we can think, we can memorize, we can do all possible things. And I think one thing which really makes us different from other species or thing is the brain, and things which we can do with the brain. The most important thing is like a memory, how to enhance your memory, or how to feel that once you have read it and read it for a longer period of time. So once you read it, the basic problem or the basic thing that happens in memory is registration. So once you read it with concentration and try to register that what you have read in the brain, that registration further gets translated and gets stored as a memory in the brain. So if you read it with contrast, read it with interest and focus on it. Once you have retained everything, it will be there in the brain, and then it just requires a simple brush up and the whole thing will come back. So just reading it is not sufficient. Make sure that once you read it, you understand it and it gets registered in the brain. So the kids, you see, the brain is made up of or divided into two parts, called as the right side and the left side, and is made up of three important components. One is the cerebral hemispheres, which we have got the memory, the movement, and then we have got the cerebellar hemispheres, which are the important parts which help in coordination at the moment, and third is the brainstem. The brainstem is the most important part of the brain and is the seat for life and all other activities. The brain we do, or when the brain works, it is the coordinated effect of all the three things put together. Suppose, brain is made up of millions of cells that work together to carry out a simple action. Like we say, just open and walk to the door. So that simple action requires the coordination from the ear that hears the message, then that translates to the brain and goes to our hand and legs that we need to walk to the door and open the door. So you see, a simple sentence or a thing which we do requires a lot of coordination and activities. And normally we see the commonest thing which the children have, or they have fall or a head injury. So and then you see that there is some giddiness, or you feel that you are not able to concentrate well. It's all because all these circuits or this proper functioning of the or integration of the work of the neurons is affected. So my tip to you will be that whenever you go for playing, you go for cycling, you go for things, wear helmets. Whenever you are into the car, wear a seat belt, because what happens, if once you get a head injury, definitely a small part of the brain gets damaged. And within, if the brain doesn't recover and you get a second impact, then the effects are cumulative, and that results in some part of the brain getting affected, and that in future may cause some problem. So always protect, wear the guards, that is important.
I'm Dr. G.P. Subaya, spine surgeon, Sunshine Hospitals, Hyderabad. Hi kids, so would you like to know a little bit about the spine? The spine is a structure which extends from the base of the skull, that means base of the head, up to the buttocks. It is the one which is important for maintaining the correct posture. So do you know the difference between the human beings and the animals? The human beings are erect, we walk on 2 legs, whereas all the animals walk on 4 legs. So why we are erect is the spine. The one which is responsible for erect posture is the spine. So spine is the most important and one of the most important structures in the body. Having said that, there are quite a few problems we see, spine problems we see in children. So if you look at the normal shape of the spine, if you see from the back, it is absolutely straight. Whereas if you see from the side, or if you see the spine in profile, it has a few curvatures, it's kind of S-shaped. So some sort of concavity in the neck, convexity in the upper back, and the concavity in the lower back. So this is the normal shape of the spine. If you look from the back, it looks straight. If you look from the side, it looks S-shaped. So if there is any alteration in the shape of the spine, that is known as what we call spinal deformities. And these spinal deformities are very common in children, especially between 10 and 15 years of age. So there are 2 types of spinal deformities we see. One is called scoliosis and the second one is called kyphosis. Scoliosis is nothing but sideward bending of the spine. That means spine bends towards one side. This is a very common problem seen in approximately 10% of the children. So that means it's a very, very common problem. And kyphosis is forward bending of the spine, and we also call it as hunchback. So how to detect these problems at an early age or at an early stage? So out of these 2 deformities, the scoliosis and kyphosis, scoliosis is much common problem. So the children having scoliosis, that means the sideward bending of the spine, can be easily detected by merely inspecting the spine. So how do you do that? So if you look at the shoulders of the children, normally in normal children, both the shoulders are at equal level. But if one shoulder is at a lower level, the other shoulder is at a higher level, then you know the child might be having scoliosis. The second thing you have to look at is the shoulder blades. From the back, normally both the shoulder blades are at equal level and they are equally prominent on both sides. Whereas in children with scoliosis, one is at a lower level, the other is at a higher level. One shoulder blade is prominent, the other shoulder blade is less prominent. So this can be seen easily if you just look at the child. And the third important thing is, once you stand, there is a gap between your tummy and the arm. So the arm, this distance is equal on both sides in normal children. If it is kind of reduced on one side or increased on the other side, then the child might be having this scoliosis. So keep observing the children, look at the shoulder levels, look at the shoulder blade levels, look at the distance between the arm and the tummy. So if you see any difference, just consult your nearby orthopedic surgeon. And they take measures to prevent progression of this scoliosis. If you neglect this problem, there is a strong possibility this becomes further and the spine becomes crooked, and that can eventually lead to the death of the child also. So detect this, keep observing the children, and try to know a little bit about the spine.
I am Dr. Venugopal Pari. I am a consultant laparoscopic and bariatric surgeon for Sunshine Hospital, Paradise, Secunderabad. Laparoscopic surgery is basically a modern surgical technique in which operations in the abdomen are performed through a keyhole. It is also called as keyhole surgery. This surgery has picked up in last 10 to 15 years, and now most of the surgeries are done laparoscopically. It is useful for all gastrointestinal surgeries and all minimally invasive surgeries. The surgeries which are commonly done by laparoscopy are appendicectomies, gallbladders, hernias, all intestinal surgeries, as well as all bariatric surgeries. In pediatric age group particularly, the common surgeries which are done through laparoscopy are diagnostic laparoscopy, laparoscopic hernia repairs, laparoscopic appendicectomies, sometimes laparoscopic splenectomies, and laparoscopic bowel surgeries. The advantages of keyhole surgery or laparoscopic surgery is that because of the reduced wound size, the chances of wound contamination and pain are much less. So the pain factor is significantly reduced. The patient is apparently painless, and he can be back to back to their routine activities within 2 to 3 days. As the wound is less, the chances of post-operative hernia, the chances of post-operative wound dehiscence are much less, and the respiratory complications and other complications which are associated with conventional surgeries are very less. As I said, the commonly laparoscopic urological procedures are also done along with the conventional laparoscopic procedures which I just mentioned.